ICU nurses' challenges in providing care for COVID-19 patients, article critique. Background and significance. The background and significance of the proposed study enable the audience to focus on the factors analyzed in the survey. The surveyors have stated that the investigation will focus on challenges experienced by nurses when offering services to COVID-19 patients. Research question and hypothesis. The research seeks to answer the question regarding challenges encountered in ICU by nurses when attending to patients infected with COVID-19. It has been used to help the researcher achieve the goal of the survey. Also, the purpose of the study has been validated since data acquired in the research focuses on the research objectives. Review of the literature. The surveys have used other resources to guarantee that more data is acquired during the study. The conceptual framework was also used to ensure that the research questions would help the surveyors achieve their objectives. The literature review should also be presented in a manner that can help other surveyors understand the research procedures. In this case, the researcher organized the information to allow an easy understanding of the data provided. Methods: internal and external validity. The controls for the threats to internal validity have not been exercised in the survey. Also, sources of bias have not been analyzed, and one cannot analyze how they were dealt with in the study. Research design. The quantitative research design was used in this study, whereby interviews were used as the data collection method. Semi-structured face-to-face interviews enabled the researcher to acquire raw data from the participants. Thus, the qualitative descriptive study was utilized to meet the objectives of the study. Sampling. A sample involving 17 rotating night shift nurses working in the medical ICUs of the COVID-19 center in Urmia, Iran, was used for the survey. The recruitment of the participants involved purposive sampling. Bias was also limited during sampling since the inclusion criteria were exercised. Legal ethical issues. The researcher obtained approval from the Research Ethics Committee of Urmia University of Medical Sciences. The researcher guaranteed that the participants were free to answer any question and that no one would be forced to participate in the survey. Correspondingly, confidentiality was encouraged, and participants' names were not disclosed. Data collection methods and procedures. Interviews were conducted and allowed the researcher to interact with the participants and acquire adequate raw information. The participants were encouraged to present their experiences when caring for COVID-19 patients in ICU. Also, information was recorded since it would be analyzed to acquire valid results. No bias was experienced since all participants were free to present their information, and privacy was encouraged. Reliability and validity. No appropriate method was used to test the reliability of the instruments. The kinds of threats to internal and external validity are not presented as weaknesses in reliability in the study. Additionally, one cannot determine how the reliability and validity affect the strength and quality of evidence provided by the study findings since they have not been presented. Data analysis. Data were analyzed using consent analysis based on the Granheim and Lundman method. 3 authors ensured that they classified and analyzed data using MaxQDA-10. Thus, the testing of the research question supported the research question. The tables used also have precise titles and headings and do not repeat text. Conclusions, implications, and recommendations. The results of the research question have been presented objectively, and the conclusion has been used to show the challenges faced by the nurses. Additionally, the information regarding the results is concisely and sequentially presented to ensure that future surveyors can acquire credible information from the study and use it in their research. Applicability to nursing practice. The strengths of the research outweigh its weaknesses since it presented adequate information regarding the research question. The benefits of applying the study findings are that it can limit the challenges faced by ICU nurses offering care to COVID-19 patients.